A top scientific advisor is warning India's government to prepare now for a third and more devastating coronavirus wave. The warning comes as India broke its own coronavirus record, reporting 412,000 new cases in 24 hours. That brings the nation to more than 21 million cases with more than 230,000 deaths. Meanwhile, India's prime minister is facing increasing pressure to place the country back on lockdown, but is resisting because of the expected economic fallout. CBS News foreign correspondent Chris Livesay has more.
As the COVID surge continues to kill Indians in record numbers, hospitals like this one are struggling desperately just to have enough beds, and as we're witnessing, are having to turn the sick away.
Short of breath, desperate for oxygen, and a bed. But here at the Mulchan Private Hospital, with some of the best resources in New Delhi, there are none left. So they send her away.
Where we keep patients on BiPAP support.
Dr. Nabil Rahman runs this emergency room, now converted into extra space for an ICU, absolutely crushed with patients. He says they resorted to purchasing their own oxygen privately at exorbitantly high prices amid a calamitous shortage nationwide.
Patients come to a hospital because they're seriously sick. They need ventilator support.
These patients are extremely sick, but also extremely lucky. Lucky to have oxygen, lucky to have access to doctors, lucky just to have a bed in a hospital that's already over capacity and in a country that's desperately waging a war and losing to COVID-19.
Many of India's victims got infected during recent mass religious gatherings promoted by the Hindu Nationalist Party of Prime Minister Narendra Modi as it campaigned in recent state elections. School teachers ordered to oversee voting stations were among the biggest victims. Some 700 died of COVID. One of the surviving teachers is the mother of Shad Hassan, now on life support.
I'm watching patients collapsing in front of my eyes.
Hassan says he'll never forgive the government for putting her life at risk.
At this time of crisis, how can you be so stupid?
For most Indians, it's even more dire. Some dying in line as they plead for oxygen, a hospital bed, or even just a place to be laid to rest.
And just keep in mind India's massive size of 1.4 billion people. And with many cases and deaths going unreported, the real numbers are feared to be as much as 10 times higher, with new cases now reported all across South Asia. Tanya?
Chris Livesay, thank you. As the coronavirus rages across India, there are concerns political pressure is covering up the true extent of the crisis. Government officials have claimed there isn't an oxygen shortage and even threatened actions against hospitals if they continue to say there is. This comes as foreign donors begin to question possible delays in distributing medical equipment. On Tuesday, the Indian government released a statement saying, quote, a streamlined and systematic mechanism for allocation of the support supplies received by India has been put into place for effective distribution of the medical and other relief and support material. Joining us now from Mumbai, India, to talk more about this is Rana Ayyub. She is a global opinions writer with The Washington Post. She's been covering the crisis in India for weeks. She recently wrote a piece in The Washington Post describing her experience with the pandemic and the reports from colleagues about deaths being underreported. Rana, welcome. It's great to have you with us. Now, you, of course, have friends and family in India. You've written and talked about your experiences. What is the reality of this second coronavirus wave there? What are you seeing and hearing?
Well, Tanya, this is a devastating wave. Like I just tweeted less than 30 minutes ago that just today I have lost 4 people who are distant relatives, friends, acquaintances. And this is every family in India. Every day we wake up to losing a friend or friend's family members or relative. It's devastating lives that we had never really anticipated. People, especially in the age group between 30 and 50 this time around, the younger ones, we are losing them. There is devastation everywhere. You just mentioned in your report about the chief minister of the largest state in India, Yogi Adityanath, actually issuing warning to hospitals who said that they are running short of oxygen. There are multiple hospitals in Uttar Pradesh and New Delhi, the national capital, where hospitals are releasing SOS messages every hour that we do not have oxygen. Although we have got international aid, we have been getting international aid for the last 3 weeks, including oxygen cylinders, oxygen concentrators, and medication. We do not really know what is happening. We do not know the scale of the devastation. And there is no transparency. We don't know where has the international aid that has come to India, where has that gone? The government is not making sure to be transparent. As much, again, it's not being transparent about the numbers. The official figures for today are 3,800 deaths in a day. But from what we see every day, the numbers, like your correspondent said, and like I said in my cover for Time magazine, are at least 10 times higher. Because just one funeral in one small town in Uttar Pradesh. We have a video where 450 funerals happened in one day in one small town. One can only imagine the scale of devastation. Plus, a lot of people, especially in rural India, are not going to hospitals. They're not getting diagnosed. They're not getting tested. They're dying before they're getting tested. So we don't even know the scale of the devastation as of now, Tanya.
And Rana, you're saying that some of your tweets regarding this underreporting have been deleted. Who is doing this, first of all, and what benefit is there to cover up this information?
Not just mine. There are 52 tweets that have been deleted by Twitter on the direction of the Indian government. Basically, the Indian government thinks these tweets are too critical and spread fake news about COVID-19, where the actual reality is these tweets are speaking about the sentiments on the ground. These tweets are giving the actual figures on the ground. So instead of making an effort to stopping news from coming out, the government should make the effort to stop the virus and stop the infection from surging all across the country and stop people from dying. So the only effort the government is making in a way right now is to kind of build this image that all is in control and spending all its resources and hiding the facts and figures from the ground. I think the government's priority should have been something else. People are dying without lack of oxygen. Forget rural India, in the national capital itself, where miles away from the Prime Minister's own residence. There's a lot more that India could do right now than hiding the real facts and figures and the news.
And Rana, a top scientific advisor to the Indian government is now warning that the country needs to prepare for a third wave of the coronavirus. What are you hearing about that? And give us your response, considering this second wave is still far from over.
Well, there have been multiple news reports today, and a lot of scientists and doctors are talking about a crippling third wave. While another expert gave out an interview yesterday on Indian television that the number of deaths could double up in the next 2 weeks in India. So India is just not prepared. And also, if we do have a devastating third wave, which is likely around the winters in next 6 months from now, we have not even developed immunity for that. We have not even been vaccinated. Not even 10% of the Indian population has been vaccinated. Even those who have been vaccinated have only got the first shot. The government opened up on the 1st of May vaccination for everybody above the age group of 18. But anybody who's trying to register is unable to find a slot because there are no vaccines. The man who headed the Serum Institute of India, the one who was manufacturing the AstraZeneca vaccine, has left for London because he's saying that he's getting threatening calls from people because there are no vaccines. So I wish the government had really made efforts to vaccinate its entire population, because if what the reports are about the third wave are indeed true, and of course it is imminent that we will be struck by a third wave, India is ill prepared. We are only still spending 3% of our GDP, despite being the world's one of the emerging economies. We are still spending 3% of our healthcare. So a lot more should be done to in a way kind of make sure that our hospitals are well prepared. We're doing nothing. We are just right now helpless right now, Tanya. I think the third wave will be much more crippling than what we are witnessing right now.
That sounds absolutely devastating and impossible to believe. Rana Ayyub, thank you so much. Our hearts go out to everyone in India right now. Thank you for joining us.
Thank you. Thank you.